So, just to give you an update around COVID and how things are going for Stockport at the moment. In the last week, that's the week to the 20th of January, we've had 933 cases across Stockport, which gives us a rate of 318 per 100,000. Our rates have been our rates were rising rapidly through the end of December and into early January, and then since we've entered lockdown, we've seen that slow and now start to decline. The rates through that period have been highest in our 18 to 29-year-olds and 30 to 50-year-olds, and those age groups have now started to decline. We've had an ongoing slight rise in our cases in our over 60s, hoping to see that start to slow this week now as well, that as the rest, along with the rest of the community. Obviously, those rates in our over 60s do more readily translate to hospital admissions, and we've seen really serious pressure on the hospitals at the moment across Greater Manchester, and Stockport's no exception. They're coping well, but it's an extremely challenging situation in the hospitals. I think the key messages for us all now are to be extraordinarily vigilant about the measures to control transmission. We really need people to be adhering to isolation if you're a case or if you're a contact of somebody who's a confirmed case. It's the biggest thing that we can all do to reduce transmission. The usual messages around hands, face and space continue to be extremely important. Space is really important because COVID's spread through the droplets that we release from our nose and mouths, and those essentially getting to other people. So if we leave 2 meters, that really stops that transmission through that way. Wearing a face covering, and that needs to go right over your nose, completely covering your nose and your mouth. So not wearing it down here and not wearing it that stops here. It really does need to cover your nose and mouth. That works by catching those droplets, stopping them from going out into the wider atmosphere around you. So face coverings that cover your nose and your mouth, really important way of reducing transmission. And then finally, hands. Washing your hands regularly and thoroughly, particularly before you eat, particularly when you've been out at all, or sanitising them. That stops you being able to, if you've picked up virus on your hands at all, it stops you spreading it around, and it also stops it getting into you, because if you have touched something that's contaminated, your hands touching your nose or your mouth or your eyes, that's a way in, those membranes are a way in, and that's how the virus can get into you. So that's why hand washing continues to be really important. We are aware of the new variant, B117. The presence of that in Stockport has been increasing over the recent weeks, and we have seen that growing to probably somewhere in the region of 70% of our cases now are that new variant. Of concern, particularly because of how much more transmissible that is. So it's exceptionally important just to be even more firm and vigilant and mindful of all of those measures. It's the same way it's spread, but it just means that for every one case, more people may well become infected. So same measures: isolation, distancing, wearing your face coverings, washing your hands. Those measures remain really vital, but let's keep to them and be even more aware of them. Over the recent weeks, we've also seen more outbreaks in workplaces. So just a reminder to everybody to be following all of the guidance that your workplace will have put in place for you, but thinking about all those measures wherever you are. So if you're in work and you're having to sit 2 metres away from somebody, that's really important. But then don't go and make a cup of coffee or something with somebody who you're working with and be closer than that 2 metres at those points, because it's those little slips that can be occasionally where transmission may happen. So let's be really, really cautious about all of our movements, and wherever we are, keeping to those rules. People will be really pleased to see that vaccination's going very well. We've got really, really good history of vaccination across Stockport. Our GPs, our primary care services are fantastic at delivering, for example, the flu vaccination, and they're certainly doing all they can to be getting that vaccination out across Stockport. There's 3 main ways that people will be offered a vaccination. There's the hospital hub, that's predominantly offering vaccination to health and social care workforces, so that's up at Stepping Hill. We've then got 7 sites across Stockport where the GPs have come together in what's called a primary care network, and the practices all offer vaccination for their patients through one site. So there's 7 of those across Stockport. And then finally, there's also the mass vaccination centre at the Etihad. That's open to groups across Greater Manchester, and we'll be sending some of our key workforces up to get vaccinated there. Individuals may also be offered a vaccination at the Etihad Stadium. That's optional. You'll still be offered vaccination through your GP practice. So the Etihad is an option available. If that comes first, I'd suggest you take it. Really important that people do take up that offer when it's made available to you. We're working through priority groups, and at the moment, alongside protecting the really key workforces that support people most at risk, the main focus of the priority list is around preventing mortality from COVID. So that's why the Joint Committee for Vaccination and Immunisation, who make these recommendations nationally, that's why they've prioritised predominantly in age order. So we've started with our very oldest, most vulnerable cohorts of residents who are living in care homes, or and then working through the age bands over 80s, and then 75 to 79. So that's the reason for that prioritisation. Over time, the rest of the population will be invited, but we work in that priority order to make sure that we're really maximising the impact that the vaccination can have at this stage. It's also really important to remind everybody that vaccination isn't kind of permission to then stop doing any of the other measures. We need all of these tools, all of these measures in place at this moment in time, and for a good while to come yet, to make sure that we're protecting our population. So even if you have had your vaccination, you still need to adhere to those measures around social distancing and wearing your face covering and washing your hands. It's really important that we all keep this going. At this stage, we don't know what impact the vaccine will have on transmission. So whilst you are likely to have some risk reduction benefit from the vaccine, we don't actually know what that will, the impact of that will have on the wider population and how well transmission will be affected. It's really important to go and have your vaccine when you're offered. The COVID vaccinations have been through the same regulatory processes as all our other drugs and vaccinations go through. And so they really have been checked to make sure they're safe and effective, and they've passed all of the usual standards in those respects. So really important for people to go and take up that offer. You'll see lots of information around. Make sure you're getting your information from really reputable sources. We'll be putting out as much information as we can to help you make that decision, but I really would encourage people to take up the offer.